You know, the President of the United States and the Speaker of the House are telling the American people that what they're doing is going to expand access to health care, that people will have more health care, more affordable health care, when we know that what they're doing is going to throw tens of millions of people off of health care, particularly working class and low-income people. So they're saying more health care, but what they're actually selling is less health care. And where I come from, that's called snake oil, sold by snake oil salesmen. And I don't say that lightly, because a fraud is being perpetrated on the American people right now by this administration. Many, many communities are going to be hurt by this train wreck that is moving through Congress. But I want to focus today on one community, the LGBT community, which is going to be particularly harmed. There is a myth in this country called the myth of gay affluence, that LGBT people are somehow wealthier, more affluent than the population at large, and that is a myth. It is untrue. We have significant challenges with poverty in the LGBT community, particularly in LGBT communities of color, among young people, among seniors, among transgender people. We have higher rates of homelessness in the LGBT community than in the community at large. LGBT people are less likely to have traditional family supports. Some people are disconnected from their families. People are less likely in the LGBT community to have adult children to look out for them. The LGBT community traditionally and for many, many years has lacked the same level of access to health care as the community at large. And for that reason, the Affordable Care Act was an absolute massive benefit to the LGBT community, and the rates of increased insurance participation were higher among LGBT people. The LGBT community benefited significantly and continues to benefit from the Affordable Care Act. The repeal or demolition, or whatever you want to call it, that the Republican Congress and the President are moving forward to destroy the Affordable Care Act will have profoundly negative consequences for LGBT people in this country. For people who are HIV positive, they will lose access to life-saving health care. They will lose access to life-saving drugs. We will start to see an increase in death rates among people living with HIV. And because taking HIV medication can make someone who's HIV positive non-infectious, people with HIV who lose their health care will become more infectious. We will see an increase in HIV infections. For people who are negative, who because of the Affordable Care Act have access to a once-daily pill called PrEP, or pre-exposure prophylaxis, that reduces your risk of getting HIV by about 99%. More and more people will lose access to PrEP, and we will see an increase in HIV infections. We know that lesbians have a higher rate of breast cancer than women as a whole, and we will see more women, more lesbians, and other women who will not be able to have the screenings that they need and the treatment that they need to detect this terrible disease early and to treat it aggressively. We know that our transgender population has had huge struggles accessing health care and accessing culturally competent health care. Our transgender brothers and sisters will struggle as they lose access to health care, as people are kicked off of the Affordable Care Act, kicked off of Medicaid. We know that this proposal, this train wreck, will disproportionately harm older people whose premiums will go up and who will lose access to health care. And we have a growing population of LGBT seniors who often do not have adult children to care for them, who will lose access to health care. I could go on, but I will stop there. This proposal is terrible for so many people, and it needs to be stopped.